just happened to be passing by a Screen Actors Guild parking lot trailer where they do screenings. I was there on Health Day, and I went in to get the screening done when I was 48, and then I was just about to turn 49. And they said, well, take these numbers with you, or the numbers you're going to get in the mail. We'll send you results. Take them into your 50th, on your 50th physical. Take them in and show them to your doctor. So show them to the doctor. Doctor looked at them. Okay. Then he ran his own test, and he looked at them and he said, well, these are increasing a tad, and I'm going to send you over to the doctor's office, to somebody who knows what they're looking at. So then I ended up here with Dr. Sanford, and Dr. Sanford said biopsy, and then we go to Dr. Kim Michelle, and who is the surgeon of surgeons in my book. And they said, yo, there are options, and he showed me his video on surgeries, and then I walked out of here, and probably by the time I got in my car, realized that I had enough confidence in him to be able to pull that operation off. From what I'd seen in the video, that we set the surgery date. I had them set the surgery date right away. I didn't want to pass go, didn't want to collect $200. I wanted to have the surgery now. And I think it depends on the amount of, and I don't know if you probably had conversations with your surgeon beforehand, is the conversations I had with Dr. Michelle beforehand, which allowed that sort of okayness to settle in you that, hey, I'm going to get this taken care of today. And that's exactly what happened. When I went in for surgery, it was not a bad thing. You're 100% correct. It was not a bad thing. I just knew that at the end of the day, no matter what happened, I was going to be okay. And I had that comfortableness with him. And, of course, the rest of the staff. But I truly had some form of comfortability with his ability to do that task and for me to come out okay. So you're right. It wasn't a bad day. It was like, okay, post-operation, I'm in the hospital for a couple of days or a day and a half, and then home. But I knew that I was better than I was before I went in. Post-surgery, there is some pain as you're trying to pass fecal matter for the first time. So when it's like giving birth, I would assume that feeling is because the surgery's right above it. And, that's where you're on the liquid diet, but the first time you have a solid bowel movement, it's like, yeah, it's painful. It'll almost knock you off the stool if you're not really prepared for it. But that diminishes. It truly diminishes, and very fast. So as far as pain from the surgery, non-existent. I had those little holes in the side of me, those little robotics. That was it. That's all I had. So as getting into as the best shape I could before the surgery, walking, exercising, stretching, getting into the best shape I had prior to surgery, and then having the surgery, my recovery time was, I was, as soon as they pulled the catheter out, I was back up on stage the following week. So, I mean, in Hollywood. So I didn't have a problem with pain. There was no such thing. Am I better off today than I was before I had the cancer or found out I had the cancer? The answer is yes, for a multitude of reasons, one of which being that it puts into everybody's life, a little bit different perspective. You get a little bit different viewpoint on mortality and vulnerability. And so coupled with those things that you didn't have beforehand, if thinking you're invincible and nothing is ever going to happen versus, oh, you're vulnerable and things can happen. So you have that going for you, and you have that in your mind, and yeah, you take better care of yourself, you do things differently, and you learn how to dance in the rain.